Program format. So the phases and stages of progress within your program. This is the meat and potatoes, guys. This is so important. And the SAR is going to focus a lot on this because this is what builds success in your programs. So this is going to outline the requirements for progressing within the recovery residence, including length of stay, employment and community integration, and completion of your recovery plans. So your program format should prioritize person-centered social model approaches to recovery. Your program format should not require any terminology or language that would require licensure you do not maintain. So if you are 1, 2, or 3, we should not see any of that terminology within your program format. That should only be for our level 4s that do have and provide some outpatient levels of support. We want to focus on recovery integration. So your program format needs to include a minimum of 3 meaningful and measurable activities within the social model of recovery. And with our level 4s, if it's a more restrictive level of care, then it's going to be more of an introduction to different modalities out there, but not necessarily that they're attending 5 meetings a week on their own because they may be in a more restricted environment. But we do need to make sure that it's 3 meaningful and measurable. So we're not going to just say they attend meetings every week. How many meetings do they need to attend every week? Does that change from phase to phase or as they progress through their recovery? The program format also needs to include a community integration element. So that's work, school, volunteerism. How are they being integrated into the community? And at what point do we start doing that integration? Is it part of a phasing system? Maybe they're restricted for the first 30 days and they're working on their recovery. And then phase 2 is when they go out and seek employment or work or volunteerism. And then it needs to be clearly defined what a successful completion of your program looks like. Additionally, we want to make sure that the outcomes are measurable. So we want to, again, high emphasis on the minimum of 3 meaningful measurable activities within the social model of recovery and that 1 community integration element. We want our residents' responsibilities to increase with their progress and recovery. And so what does that look like in your program? What additional privileges do residents receive from progressing and progressing through the recovery format? So do they get overnights? Do they get extended curfews? Do they get access to vehicles and phones? What does that look like in your program? And then for our levels 1 through 3, we want to make sure that length of stay is determined by the resident and not by the provider. So as long as the resident is doing all the things that they're supposed to be doing and paying their fees, they can technically stay there as long as they want. Though they may transition to different phases or different locations within your program, such as a grad house, but they can stay as long as they want. And then in our level 4s, the length of stay is going to be determined by the provider and not the resident. And it's typically in correlation with their treatment plans. Although you guys may opt that the resident can stay longer than that because it's beneficial to the resident and the community. Ultimately, the determination on stay comes down to you all. Our sample resident weekly schedule. So we just want to provide an example of a weekly schedule, including any mandatory meetings, curfews, support groups, formal times to meet with staff, and complete assigned chores. House rules and consequences. We need to include in the handbook a list of all the rules and guidelines along with corresponding consequences for any infractions. There needs to be a complete list of consequences. We can't just make things up as we go. The resident needs to know at the time of orientation what is going to be expected of them, and if they violate or breach any of those expectations, what the consequence is going to be. And obviously, the consequence may differ from infraction to infraction, with more serious issues leading up to discharge, while lesser violations, restricted curfews or more chore assignments or whatever you all are doing in your homes. So we're going to look to make sure that your rules evidence structure and accountability. Identify which rules, if broken, will result in discharge from the program. Include a clear list of all possible consequences for rules and rule infractions. Include a prohibition against the return to drug and alcohol use and drug-seeking behavior. Rules regarding smoking and designated smoking sections that correspond with good neighbor practices. Rules that enforce good neighbor practices. Rules that foster health and safety within the residence. Rules regarding guests and visitors in accordance with state law, and that is not really for you all, but really what we're talking about when we talk about state law is minors, when a minor is going to be allowed in the home. Obviously, we don't want to have overnights and into the night hours, but what are your rules regarding that? Rules regarding sexual activities and relationships within the house. Rules relating to fighting and violence, stealing, maintaining drug and alcohol-free environments. Do you guys have any restricted places of employment that would need to be included here? You may not, but if you do, we want to list them out. Rules in reference to program requirements and participation in their recovery plan, relating to chore assignments and cleanliness of the overall property. Any dress code or personal appearance rules. Again, you may not have that, but if you do, you want to make sure that you include it here. Rules relating to curfew, financial obligations, failing to comply with drug testing protocols, destruction of property, and clinical requirements for our level 4s, or if you're a 1 through 3 and you require the resident to follow any recommendations of their treatment plan after they exited their facility, you would include that here as well. And do we capture the resident consent? Good neighbor policy and consent. So we need to include orientating residents to policies and procedures to ensure that the recovery residence is compatible with the neighborhood and maintains good relationships with its neighbors. So those compatibility rules, we want to make sure we are addressing noise, loitering, parking, lewd and offensive language, cleanliness of property, music, smoking, traffic, and privacy. We want to make sure that we're doing an orientation with residents on how they should greet and interact with neighbors. How do residents address conflict? And again, we talked about them not trying to handle that by themselves, but rather providing the contact information for responsible staff instead of trying to resolve those themselves. And then again, we want to make sure we're capturing the resident consent. Hazardous item search policy and consent. The recovery residence needs to conduct searches for prohibited items, and residents are required to provide consent to those searches. So we're going to provide the residents with a list of all prohibited items, along with consequences or expected actions to be taken upon discovery of a prohibited item. And that, again, may differ from what happens at the time of admission when we find something versus what happens with someone who's been with us for a while. The consent form, we want to make sure that they are giving us authorization to search their belongings, their physical person, and if they have any vehicles, search during the course of their stay for any of those prohibited items, and what are the consequences for having them. Medication storage and usage policy and consent. Policies and procedures regarding medication storage, documentation, and communication with healthcare professionals are going to be outlined in this section. So we want to include a list of prohibited prescription as well as over-the-counter medications, a record of medications that the resident is taking and in possession with, A policy and procedure surrounding the communication with those healthcare professionals for ongoing support and recovery planning. Where are residents to store their medications? And at minimum, if residents are going to be holding on to their medications, we want them to be out of sight, including over-the-counter medications. Anything in a pill bottle needs to be out of sight at all times. Though you guys may recommend lock boxes or provide lock boxes, the minimum is going to be out of sight. Access to medications when they're stored by recovery resident staff. How are residents going to access those medications? Do you have specific times? What is the protocol for that? What happens if they miss their medication observation time? Guidelines for staff documentation of medications, self-administration by residents, and access to that documentation when applicable, if the resident wants to see that. And then a reiteration of House rules and guidelines relating to medications and consequences in the event of infractions or non-compliance. Drug testing and toxicology policy and consent. So we want to go over the types of tests employed and the consequences for failing to comply with drug testing requirements. And so we're going to cover all of the things that we do in-house, and then also if we utilize any outside labs or labs that we may own, when are tests sent to those labs and who is financially responsible for them? Or is it the resident? If the resident wants to dispute them, how do they go about that? Do they have to use a lab of your choice? What does that look like? We need to have them consent for utilization of any outside toxicology labs, any fee schedules in regards to any type of testing whatsoever that we perform, and any potential costs that they may incur, and have them consent to the supervision and observation of tests. Permission to provide drug testing test results to caregivers if applicable, and consequences for failure to submit any alcohol and drug testing. And also timeframes. If they have an hour to produce a sample, then you want to make sure that you outline that as well. And then lastly, procedures for how residents can dispute a test result. Discharge policy and consent. This should cover and list all the support in place for addressing discharge assistance, be it because they have successfully completed the program or an event resulting in leaving the home prematurely, such as substance use, major rule violation, or just abandonment. And we want to make sure that it includes the support for the resident transitioning out of the recovery residence, having it be that they successfully completed the program. Clear communication of rules and consequences in the case that major rule violations result in immediate discharge. Clear communication about discharge secondary to abandonment of placement at the recovery residence if they just do not return to the home. Property and medications that are left at the recovery residence, what are we doing with those things? And again, at minimum, we want to hold on to any belongings for 10 days. The residents need to have a clear understanding of financial obligations. If the resident is leaving the home, how are they getting the refunds, or do they forfeit any fees for prematurely leaving or not giving you all the adequate notification of them leaving? Notification to emergency contacts, probation, parole, or any care providers. And then what does our alumni program look like if it's a successful completion? And then very importantly, we want to make sure that we're providing referrals to safe alternative dwellings or higher levels of care in the event of discharge that's premature or for administrative or relapse. And even if they are refusing our referrals, we do want to make sure that we are providing them with resource guides in case they change their mind after they've left the property. Emergency, non-emergency policy and procedure and consent. This is just emergency policy. Sorry, this is a typo here. So we want to make sure that we are providing residents with what they are supposed to do in the event of an emergency. So we talked about the difference between policy and procedure and resident handbook. And so this is going to be different than what you submit to us for your staff policy and procedure manual. This is specifically what residents need to be able to do. So we want to include orientation specifically on emergencies at the time of admission to make sure that the resident knows what to do then. But we also want to make sure that our emergency policy and procedure that is resident facing is also posted in each one of our homes in conspicuous locations. And then we're going to have evacuation maps also posted. In our emergency policy and procedure, it should include a plan in place regarding contacting emergency contacts in the event of an emergency, the protocol for medical emergency and overdoses, and the location of Narcan in the resident. Should you decide that you want residents to acknowledge the presence of Narcan in your home, if it's only staff accessible, you did want to still have the how to administer naloxone pictures because residents may have their own that they are discharged with, but you don't want residents to act on another resident's behalf in that situation. But if it's well known throughout, you have Narcan located everywhere, then you want to make sure that you include those policies and procedures. Procedures for snow event planning and implementation, both minor as well as major fire events, and any materials that are provided for fire safety, procedures for fire drills, and what residents can expect in those scenarios. And then we did cover flooding, and also flooding we need to add to that list. We also want to have our emergency, non-emergency contact sheets, and that's going to be located in your handbook as well as posted within the homes. And this is just a comprehensive list of emergencies and non-emergencies, provided to the residents. So what is the phone number for non-emergency police, local detoxes, hospitals, shelters, suicide hotline, and also any reporting agencies such as FASAR.